Wow. Wow. So you created a business where nobody else really saw an opportunity. And so tell me more. How does this work? And so people are going to buy your program to learn how to maximize the discounts they could get on retail products that they need every day, right?
Essentially, couponing is easy, but finding the order of operations, because I mean, you think with digital couponing, what the stores are offering, is individuals, and then what the actual corporate side of that is offering, and then the manufacturer coupons on top of that. You just hit one layer of discounts, across the board. And like I say, you can find stuff, things that you use every single day for, 90% off. Now, in the course, we're looking to teach something along the lines of ethical couponing. So, we're not just going in like the extreme couponing stuff.
How do I find it?
ChainsawCCC.com/courses. We've got everything you need to know to get started immediately. Come check us out. What's up, everybody? This is your boy Chainsaw. Boy, this week there is a storm that is a brewing. I'm telling you, it has been a wacky week. Or, well, I guess last week. Super wacky week, right? There's been so much happening, and there's so much to cover. So let's just jump right into it. Firstly, I did want to say we've made some changes here in the studio. We're formatted for podcasts now. To be quite honest, I just got sick and tired of people asking me, "Oh, Chainsaw, you tell them I got a YouTube channel. Oh, you got a podcast. I was watching your podcast. Okay, it's not a freaking podcast, but it's a podcast now. Okay, so get it, get it on Apple iTunes, Spotify, wherever podcasts are available, right? Wherever you be getting the getting's good, right? So here we are. But anyway, so to jump right into this has been a pretty wacky week as far as just COVID news, our government. Oh, nope. COVID news, our government, just in general, right? Now, I would like to think that this is all, when it comes to COVID-19, this is all nonpartisan, and it should be. I mean, it's not that it should be. It is nonpartisan. This is not a Republican thing. This is not a Democrat thing. This is just a thing. Like, this has nothing to do with the left or the right. Left or the right. Teleprompter screwing me up here. It has nothing to do with the left or the right. It's not a Republican or Democrat thing. It's not a liberal or conservative thing, right? Now, that's not to say, and I was surprised a little bit, that there are not some serious whack jobs on both the left and the right who have some really just nutty ways of handling the pressure, right? And we're going to just jump right into that. Obviously, later in this video, we're going to discuss some of the experiences that I had this week and some of the things that I came across. But, first, I want to take a look at something that's been happening over in, and this is something to consider. This very well could have been us had the measures not been taken as seriously, or, I guess here in Missouri, taken less seriously than they were, because it doesn't seem like COVID has been taken very seriously by very many, save for those working in the healthcare sector. But let's take a look at what's been happening in other states, specifically over in good old Idaho. So I want to just jump right into this.
Meanwhile, hospitals in Idaho's Panhandle are now under an activated crisis standards of care because of new COVID cases starting to impact other medical care. The hospitals are facing a severe shortage in available beds in the northern part of the state, combined with a shortage of staffing. Late today, Idaho's Department of Health and Welfare provided an update saying while the situation in the north has reached this critical level, the rest of the state is not far behind.
For the rest of the state, we remain dangerously close to crisis standards of care. If we will look to see if there's any additional assistance that we can provide to Kootenai Health and other hospitals in the north by way of transferring patients. And while I greatly appreciate the hospitals in the southern part of the state stepping up to that challenge, that could further exacerbate the condition in the southern part of the state, and we'll deal with that as that situation materializes.
They say they are concerned as they are seeing younger patients more than any time during the pandemic.
Wow.
Meanwhile, the hospitals in our area say they are not under crisis standards of care yet, but they are seeing a spike in COVID cases. They say that most of the cases are people who are unvaccinated. Dr. Dan Snell, Chief Medical Officer at Portland Medical Center in Pocatello, says that the number of ICU beds each hospital has changes on an hourly basis, and it is something they are constantly monitoring statewide. They are on a daily call with all of the hospitals in the state to see who has ICU beds.
From an illness standpoint, and from a staffing standpoint, and from a physical bed standpoint, we're doing all right now, okay? That doesn't mean we're out of...
Does that sound familiar? I'm just saying, like, here's the thing. I actually have friends over in Pocatello, Idaho, who are not necessarily up on masking and the whole routine, but we'll get into that.
...of the woods, and that doesn't mean we don't have our challenges. And we just want to thank the community for their support, because they've given us an awful lot of support. Encourage people to continue to be vaccinated, and that is the single best thing that the communities can do to kind of decompress the situation here locally and statewide and frankly nationwide.
Dr. Snell says that they look at the surgery schedule every day to determine that the hospital will be able to handle elective surgeries. And so far, they have not had to limit any care to any patients.
Wow, that's something else. So that's what's happening in Pocatello, Idaho. They're concerned about what's going on further north. Obviously, up in Boise, they've been having some much larger issues. You know, like I say, I've got friends out there who are not exactly big on masks, social distancing. You know, it's a good year and a half, almost 2 years in, and these are the kind of folks who still consider it a big liberal hoax. Which again, we'll get into that. Not just the left or not just the right, but also the left and some of these wacky concepts that I've been coming across from both sides of the aisle. But let's continue here and see what the updates are in Idaho. This is from KTV based out of Boise here.
But for those of us of a certain age, we learned the term triage through the TV show MASH. Remember when Doctors Pierce and McIntyre or Major Houlihan would just walk onto a bus?
I should mention that they're talking about the idea that triage for patients, that being that it's the crisis standards of care, they've changed some things about how they're handling patients. So let's just jump right into that.
Or through the stretchers that were lined up outside the surgical tent, and they would say, take that one, or he can wait, or he's not going to make it. And that's how they decided who got brought into the tent to get immediate medical attention. Idaho's crisis standards of care are kind of laid out the same way. First to get help would be those with immediate need, the red category, those with a life-threatening illness or injury where there's a chance their life can be saved, but something needs to be done quickly. Yellow, or delayed need, those who would be treated second, would have serious but not life-threatening issues, and waiting won't matter much to survival. Then there's minimal need, which is kind of self-explanatory. Minor injury or illness, you can walk in on your own kind of thing, but you would just have to sit there in pain while you wait for the third priority.
Now, the thing is, when it comes to the immediate need, and they talk about life-threatening illness or injury, life-saving interventions required, those are the first to treat. Here's the thing, though. When it comes to COVID, if this continues, and it continues to build the way that it has been, I mean, obviously, if they're coming to the point of crisis standards of care for triage, what's the next step? Well, we're going to be looking at people with those immediate needs who either have a high chance of survivability or not so high a chance of survivability. Now, if you're one of those who hasn't been vaccinated, you end up in the hospital, let's say in Boise, and this situation just continues to go as it is, there may be a chance that if your illness proves too life-threatening to take up the resources for someone that they actually could heal, you might not get the treatment that you're looking for. So if you're betting on hospital care, first of all, I don't know why you would do that, but if you are, there may come a point because of people who put themselves in that situation because of the lack of resources and the lack of personnel to handle it, that you may not get that treatment. That's taking a risk with your own life here. But let's continue.
The fourth category, and one which would have been higher in different circumstances, the expectant or code black. That means you're in a bad way and not expected to survive what ails you, meaning they could try, but it would take too many resources and likely wouldn't have the desired outcome. In crisis standards, those folks are pushed to last.
Oh, damn, I spoke too soon. It's already happening now.
Whereas in conventional care, that try would come much sooner. The State Department of Health and Welfare planned out these priorities last year when we were this close but never got there. But this is what is happening right now in North Idaho. In other words, if you break a wrist, the bones that are in your wrist, and you need surgery to fix it so it doesn't heal improperly, well, that's going to be tough. And while it may not be under the urgency of or the backdrop of war, like in MASH, nor is it because of a tragic natural disaster, this is still the state of care in 10 of Idaho's hospitals. Governor Little used this news today as a chance to address vaccinations once again. We have reached an unprecedented and unwanted point in the history of our state, he said. We've taken so many steps to avoid getting here, but yet again, we need to ask more Idahoans to choose to receive the COVID-19 vaccine. Right now, only 49% of eligible Idahoans have been fully vaccinated. And before you think, well, that's just up north, we're fine everywhere else, let's take a look at what it looks like statewide. The last week of August, the day the governor toured an ICU and saw all the COVID patients fighting for their lives, and he called it heartbreaking, the state website showed there were 72 ICU beds available. It dropped to 31 the next day. We bounced back towards 60 for a couple of days, but since September 2nd, in just 4 days, we have dropped to 11 available beds. 11 available beds in Idaho's intensive care units across the entire state. That's a drastic drop and a pretty low number, not as low as 4, which is the number Governor Little pointed to last week, while the state's website showed that 72. But because of that discrepancy, which a lot of you pointed out, the state changed the way it charted available beds. Instead of just open beds, or including open pediatric ICU beds, since September 3rd, they are tracking just beds that are available and able to be staffed.
So basically, the state of Idaho has been tracking available beds in the same way that the state of Missouri, the state of Florida, has been tracking cases. When you have a delay or a discrepancy in the numbers, it shows something different than what is actually available. In our case, there's a discrepancy on the wait time for when information gets processed from the health departments to the state. So if you actually look at our COVID cases and our COVID deaths, it will always look as if cases are going down and deaths are going down because there's a delay in those postings. It's the same crap that was going on in Florida, for months. Basically, they're just trying to hide their numbers in order to look better, make the situation look better than it actually is. But don't take my word for it. Please do not take my word for it. Check it out yourself. The information is definitely available with your local health department. So this exciting stuff has been so overwhelming that it's actually made national news or, headline news. Or at least it was featured on MSNBC just a couple of days ago. So let's take a look at that real quick.
This week, of course, Idaho had to take the terrible step for the first time in its history of activating crisis standards of care. Crisis standards of care means that hospitals have an ethical and legal framework from the state to ration health care. Because in North Idaho, they no longer have hospital capacity to treat everyone who needs treatment because of the number of very sick COVID patients swamping the hospitals. Officials in Idaho are warning that they're dangerously close to actually having to implement crisis standards of care for the entire state of Idaho. Idaho is in real crisis right now. How's the state's leadership contending with this crisis? Interesting story there, it turns out. The largest health district in Idaho is it's called Central District Health. You see it's right there in the center of the state. It has a 7-member health board that's appointed by local county commissioners. And this summer, as Idaho steamed toward this unprecedented collapse of their hospital system, with literally active duty federal troops having to come in to staff beds, with hospital care officially being rationed because they are swamped with COVID patients, this summer, in June, officials in the state's largest health district fired a 15-year veteran of that health board, a nationally recognized physician who had given mainstream COVID advice in line with federal guidelines. They fired him.
Sound familiar?
The person Idaho picked to replace him, to join the biggest health board in the state in the middle of this crisis, is this guy, who is a pathologist who runs a local medical lab. He says that we should call the CDC the Ministry of Truth because they're just like the propaganda arm of the fictional totalitarian regime in the novel 1984. He says COVID vaccines must be, quote, stopped. He calls vaccines a, quote, poisonous attack on our population that needs to stop now. He has also advocated for the use of the horse deworming medication ivermectin, which the CDC, the FDA, and the drug zone manufacturers have pleaded with the public to stop using to treat or prevent COVID, since it neither treats nor prevents COVID, but it's very easy to OD on it and make yourself very ill. This is how the local NPR station in Boise headlined their article about this doctor's appointment to the Central Health District. Quote, doctor up for Idaho Health Board spot calls COVID-19 vaccine needle rape.
So with that, we've got anti-vaxxers in charge of certain aspects of healthcare. We've seen that here at the state level. When it comes to local positions regarding, those involved in who's charting these deaths, these COVID deaths. Boy, it's time to roll those pant legs up, because it's just getting deeper and deeper.
Because he did, in fact, call it that. He was officially approved to the Idaho Central Health District Health Board this week. He had competition. There was also an epidemiologist who was up for the spot and an infectious disease specialist who was up for the spot, but they went with the guy who calls vaccines needle rape instead.
Wow.
As the state of Idaho approaches statewide crisis standards of care in hospital rationing because of the crush of COVID patients they are contending with, there appears to be a mismatch in terms of the crisis that Idaho is facing and what its leadership on the ground is doing about it.
So that's really something else. So basically what we've seen here is a state that has not taken COVID very seriously and is now facing the repercussions of that. It seems like now that it's being brought a little bit more into the limelight as far as the deaths and the mismanagement of the state in handling COVID and healthcare in general, that yeah, now that that's been made very apparent and obviously has hit national news, that the state, at least the governor, seems to be taking this a little bit more seriously, or at least is perceived as taking it more seriously. I think we saw the same thing in the state of Missouri earlier this summer, when our COVID cases and COVID deaths skyrocketed. And first, the solution was that the governor was going to put the blame on healthcare directors themselves and those who work in the healthcare sector for not asking for assistance. No quarter asked, no quarter given, I guess. And then secondly, you saw obviously the push for the vaccine lotto and different measures taken by the governor. I believe it was, and covered this in a previous video, I may misquote it, but I believe it was about $46 billion that the governor has been holding on to since 2 Marches ago, March of 2020, and finally decided to distribute that money to Missouri healthcare officials, to Missouri, to freaking hospitals, so that they could relieve some of this situation right here at home. But of course, Governor Mike Parson is big on withholding funds, as we saw. He's still holding back money from unemployment, which this should be very interesting to see how that goes out. considering the executive order, the announcement that President Biden had made just a few days ago regarding his executive order and some of the changes that we may be seeing to federal law via OSHA. But we're going to jump right into that. And we're going to get Governor Mike Parson's response firstly. But we'll get into that right after a short break, and we'll see you then.